Hi, everyone. My name is Yemaya Lewis, and I am a senior at LeMoyne-Owen College. My topic is evaluating prostate cancer awareness in higher education students, a pilot study. I chose this topic because of my brothers and my dad and my uncle. They're not in school to learn about prostate cancer and the risk factors and the symptoms that they should be on the route for. So, but this is to spread awareness, and prostate cancer doesn't get the much media coverage as other cancers, so I would like to highlight this cancer in particular. Prostate cancer is the second leading cancer death in men. It affects 1 in every 8 men when we think of our white counterparts, but 1 in every 6 men when we think of just our Black counterparts. For my research question, it is to examine the level of prostate cancer knowledge and self-reported confidence among participants following a structured educational session. For the hypothesis, participants will report high levels of awareness and understanding of prostate cancer after attending the session. And in the other slides, you'll be able to see that they actually did understand very well of high levels of prostate cancer. For our methods, this is a one-group post-survey design. And we'll get into that in just 1 second. On the left, you'll be able to see the flyer that we was able to have posted around campus, as well as physically hand out to peers. And I had some of my peers also post this flyer on their social medias to help increase our participant group. For the participant group, it included both men and women, and the age range was from 19 to 50. For our 50-year-old participant, he actually had a screening of prostate cancer before, and he shared some about his history about that. And the 19-year-old didn't know too much about prostate cancer, but now knows some about prostate cancer. For the intervention, we had Mr. Carpenter from PEAC Memphis, where he shares with his wife, and he's also been a prostate cancer survivor as well. So he's been on both spectrums of the end. He's been in the office receiving the news that he's had prostate cancer, and also on the end of educating men about prostate cancer and what they should look out for. He was able to tell us about PSA levels, where it should be low, and if they're high, that's when you want to go ahead and start looking into different risks, the risk factors and how to prevent prostate cancer. After the educational session, we was able to have a post-test to see how everybody measured up their levels and how confident did they feel about prostate cancer. Could they go explain prostate cancer to their peer, or could they go explain it to their husband or to their brother or their dad? And had their dads been trained for it as well. For the intervention, like we mentioned, the participant group, the intervention, and the post-test. During this educational session, we talked about the anatomy. So prostate, when you think about the prostate, think of a walnut. This walnut is going to be below the bladder, but it's going to be in front of the rectum. So that's where you should look for it. For the risk factors, your diet, and are you physically exercising? Can be risk factors to lead to prostate cancer. Some symptoms you should look out for. Well, for Mr. Carpenter, as a prostate cancer survivor, he realized one of his symptoms was constantly getting out of being woken up at night, having to go use the restroom constantly. So it's one of his factors. Another factor you can look out for is not getting an erection, and also back problems or aching. These can be similar to other cancers, but these can be specifically tailored to prostate cancer. And for screening, in the past, we would say about 50 years old is when you should typically go get screening, but we now know that early screening is the best prevention. So early prevention is getting tested and screened early. So now we're looking at ages for 40 to 45 to get screened for our men. For the outcomes, this is part of our survey. A question we asked was, after this workshop, how knowledgeable are you about risk factors for prostate cancer? And everyone answered either very confident or confident about the risk factors for prostate cancer is what we like to hear. And for the other question was, after this workshop, how confident were you in understanding what is prostate cancer? Everyone either answered very confident or confident as well in this one as well, which is what we like. For the conclusions, overall, our participants reported high levels of knowledge and confidence, highlighting the impact of targeting prostate cancer and education among higher education male students. Our limitation was that we did not have a pre-survey and we did not have a control group. But for our future directions, we would like to increase sample size and add a pre-survey group and seek Greek grant funding. I would like to thank PEAC Memphis, which is the organization owned by Mr. and Mrs. Carpenter. I would like to thank Meharry Medical College, HBCU Wellness Project, Dr. Williams, and Ms. Small, and Shelby County Health Department, and of course the audience and Ms. Dr. Washington as well. If you would like to contact me, the contact information is elewis073 at llc.edu. For the references, you can scan that QR code to find all my citations and sites where I was able to cite them. And as always, thank you and have a